Hello again. I'm sure you're all sick of hearing me tonight, but now we're going into the final phase. We're going to talk about anti-seizure medication or anti-convulsants. Anti-seizure medication, in most cases, anti-seizure medication, also known as anti-convulsant medication, effectively decreases or controls seizure activity. The goal of medication treatment is to use the medication with the fewest side effects at the lowest therapeutic dose that will control the seizures. Anticonvulsants reduce the excitability of the neurons, thus controlling, or in some cases, totally eliminating seizure activity. Sometimes a patient will not respond to one drug, and another drug or a combination of drugs must be tried. Other times the patient's seizures are not controlled by anticonvulsants, and other measures such as surgery are used as a last resort. Dosage adjustments, meaning an increase or a decrease in the dose, are often needed when medication therapy is introduced. Dosage adjustments may be needed during times of stress, severe illness, or when there is an interaction between the seizure med and a med needed for another medical condition. Adjustments are also often needed with weight loss or weight gain. If the patient gains weight, the dose may need to be increased. If the patient loses weight, the dose may need to be decreased. Anticonvulsant medication adjustment are frequent in children, especially during growth spurts, metabolic changes, and puberty. There are many different anticonvulsants, and some work better than others for specific seizure conditions. If more than one anticonvulsant is used, it's important to know how the two medications interact. The second anticonvulsant may enhance the potency of the first medication, and that could lead to toxicity, or the opposite may be true, and the second anticonvulsant may decrease the potency of the original anticonvulsant, which may lead to increased seizure activity. So you have to carefully check the interactions of the two meds together. A seizure med is never stopped abruptly. If a seizure med is being discontinued to start a new anticonvulsant, it is tapered over a period of several weeks. The new medication will be started at a low dose and titrated upwards over many weeks. Discontinuing a seizure med abruptly can lead to status epilepticus. A dose of seizure medication should never be omitted. If a dose is forgotten, it should be taken immediately, unless it is almost time for the next dose. Anticonvulsant meds have a toxic and therapeutic level, which can be determined with a routine serum drug test. The drug levels help determine effective doses, potential toxicity, and identify patients who are not taking their meds. Anticonvulsants should be taken with food to avoid GI upset. All anticonvulsants need to be used with caution during pregnancy because there is a link between anticonvulsants and birth defects. There are physicians that specialize in medication, and there are physicians that specialize in medicating patients with, say that again. There are physicians that specialize in medicating patients during pregnancy, and they should be consulted to determine the safest anticonvulsant to use if it is necessary to medicate the patient during pregnancy. Another interesting fact about anticonvulsants is that many of the anticonvulsants have the secondary purpose of being mood stabilizers or helping to control chronic pain. And I will tell you which ones these are when we get to the individual meds. So anticonvulsants are used for seizure disorder, neuropathic pain. They use them for diabetic neuropathy, migraine headaches, fibromyalgia, bipolar disorders as a mood stabilizer, and also for anti-anxiety disorders as a mood stabilizer. There are 6 categories of anticonvulsants used to treat seizures. And I've listed those all for you, and we'll go through them individually. I don't even expect you to remember the names of the categories. I don't expect you to remember how to spell the names of the categories. I don't even expect you to correctly pronounce the names of the categories, because I have trouble with that myself. I just want you to realize that although these medications have slightly different modes of actions, they all possess the ability to depress abnormal neural discharge in the central nervous system in order to inhibit seizure activity. You should be able to recognize these specific meds mentioned in this lecture and the special considerations discussed. The first medication we're going to talk about is Delanin or Senetowen. It's from the category hydantoins that stabilize the postsynaptic hyperexcitability in the motor cortex. But don't need to know that right now. No Delanin, excuse me, in that Delanin being the brand name and Senetowen being the generic name. Delanin is the most commonly prescribed anticonvulsant. It can be administered orally or parentally. If Delanin is administered parentally, the IV route is preferred. When given IM, the medication is absorbed erratically, causing pain and muscle damage at the injection site. Delanin is given PO in divided doses to treat tonic-clonic seizures. Pediatric dosing is weight-based. Delanin is given IV to treat status epilepticus. Even though Delanin is one of the most effective anticonvulsants, it has many side effects and adverse reactions and must be monitored closely. As nurses, it is very important that we be aware of these serious indications. First of all, let's talk about Deland toxicity. Delanin blood serum levels have a very narrow window between therapeutic and toxic. So, a non-therapeutic Delanin level is below 10. A therapeutic Delanin level is between 10 to 20. And a toxic Delanin level is anything over 20. So, in other words, a serum Delanin level below 10 isn't going to control the seizures, and a serum Delanin level above 20 can lead to toxicity. Blood levels need to be monitored closely to achieve a therapeutic effect and avoid toxicity, which can be life-threatening. Delanin levels will be monitored often when initiating treatment and achieving the therapeutic dose, Once the therapeutic range is established, Delanin levels will be done at regularly scheduled intervals. Usually, a good example would be every 3 months after you have the therapeutic level established. The signs and symptoms of Deland toxicity are slurred speech, ataxia, lethargy, dizziness, nystagmus, which is constant involuntary eyeball movement, confusion, nausea, and vomiting. That's a toxic Delanin level. The sign of a non-therapeutic Delanin level is breakthrough seizures. Other problems with Delanin, it has a lot of side effects. It has hematological dyscrasias, which is a fancy way of saying it can cause blood disorders. Delanin can cause hematological changes such as leukopenia, which means a low white blood cell count, a white blood cell count below 5,000, and thrombocytopenia, or low platelets. A CBC with differential is done on a regular basis when the patient is on Delanin, and the nurse should watch for and report any signs and symptoms of leukopenia or thrombocytopenia immediately. Signs of leukopenia are low white blood cell count or a sore throat, chills, swollen glands, and excessive fatigue. Signs of thrombocytopenia are bleeding easily, bleeding gums, bruising easily, increased menstrual bleeding, tarry black stools, and epistaxis. Remember, you would expect those symptoms because platelets, as you know, are responsible for clotting. So if your platelet count is low, you can expect bruising and bleeding. Delanin is not the anticonvulsant of choice for the patient with bone marrow suppression or a compromised immune system. Why? Because of the bleeding from the thrombocytopenia and the risk of infection from the lowered white blood cell count. If a blood dyscrasia is present, advise the patient to use a soft toothbrush to protect their gums and mucous membranes from bleeding. Personally, I would say always have the person use a soft toothbrush to protect their gums and mucous membranes. Delanin has also been known to cause hypersensitivity reactions. Not too long ago, we talked about Stevens-Johnson syndrome, and that has been reported with people on Delanin. Notify the doctor immediately if a skin rash develops. Gingivitis, which is inflammation of the gums, and gingival hyperplasia, which is overgrowth of gum tissue, are commonly seen as a side effect with long-term Delanin use. It is very important to periodically inspect the teeth and gums of a patient taking Delanin. Teach the patient to give oral care after every meal to prevent gingivitis and hyperplasia. Regular dental checkup should be done at least every 6 months if the patient takes Delanin. Delanin can also be hepatotoxic and nephrotoxic, so the LFTs and kidney function tests need to be ordered periodically. Delanin causes GI upset, so it should be taken with food. I'm almost done, just keep going. Delanin interacts with many other anticonvulsants. Some increase the effect of Delanin, some decrease the effect of Delanin. So check your drug guide if someone is taking 2 anticonvulsants. It can also react with other meds. Again, check your drug guide. Important consideration with Delanin is that you should not take an antacid within 2 hours of taking the Delanin. The antacid is going to decrease the effectiveness of Delanin, and the herbal medicinal supplement ginkgo decreases the effectiveness of it, the Delanin. So be very careful with what other meds the person on Delanin is taking. Delanin is not used for any off-label uses. It is strictly used as an anticonvulsant. The next group of medication I want to talk about are the benzodiazepines. The benzodiazepines are anti-anxiety meds. They are also used to treat seizures. The 3 benzodiazepines used for seizures are Klonopin or clonazepam, diazepam or Valium, and lorazepam or Ativan. Benzos are controlled substances. The benzos are most commonly used to treat absence seizures, akinetic seizures, and myoclonic seizures. They are not going to be an effective first-line treatment against clonic tonic seizures. For status epilepticus, Valium or Ativan IV is the initial drug of choice. When used for status epilepticus, Valium is given slowly by IV push. Allow at least 1 minute for every 5 milligrams of Valium administered. 5 to 10 milligrams are injected initially, not to exceed 30 milligrams in 24 hours. Ativan Lorazepam is also used. 4 milligrams of Ativan is administered IV over a 2-minute period, and that may be given instead of Valium to treat status epilepticus. After 1 hour, the dose of Ativan can be repeated, but it should be no more than 12 milligrams in 12 hours. Remember, Ativan and Valium are short-acting, and the doses often need to be repeated. For longer control of seizure activity during status epilepticus, Delanin and phenobarbital will be given. Patients can build up a tolerance to phenobarb and become dependent on it if it's overused. Benzos are also controlled substances and have the power to be abused. The most common side effect of the benzos is sedation. They can lead to respiratory distress, and the elderly are especially susceptible to apnea and cardiac arrest. So monitor the elderly patient on benzotherapy for seizures very carefully. Next, I'm going to talk about, very briefly, Triadone and Xarontin. You rarely, if ever, see these 2 medications used, and I'm only mentioning them because they're in your outline in your book. Triadone Triadone causes many hematological conditions worse than Delanin. And these drugs have been shown to have serious adverse reactions and fetal malformations. They're only used when less toxic drugs are ineffective. I have never used either one of them. But there is a possibility that they may try that ahead of surgery, so I just wanted to mention that they exist. The next group I want to talk about are the carboxylic acid derivatives. These drugs increase the level of the neurotransmitter GABA to help stabilize the cell membrane. The two I want to mention are Depakine, known as valproic acid, and its cousin Depakote, divalproic sodium. This is used to treat tonic-clonic absence and myoclonic seizures. It's also used, now this is, Depakote has an off-label use. It's also used to prevent migraine headaches and treat bipolar disorder. It's very commonly used in bipolar and migraine treatment. The dose is weight-based. Big side effect of Depakine and Depakote is the medication causes significant weight gain because the person's appetite increases significantly. It should be used with caution in liver disease. Depakote levels or Depakine levels are rarely done. It seldom becomes toxic. Usually they do the levels to see if the person is in fact even taking the medication. The last group of medications I want to talk about are the miscellaneous anticonvulsants. They have different drug properties in which they decrease seizure activities and don't fit into any of the groups. The first one is Tegretol, carbamazepine. It's used to treat tonic-clonic seizures and complex partial seizures. It's also used to treat mood disorders. The biggest problem or side effect with Tegretol is that it causes leukopenia, or lowers the white blood cell count, and it cannot be used in the patient with immunosuppression. The next one is Topamax. Topamax is a little bit of a newer seizure drug, and it also is used for mood disorder and migraine headache. One of the reasons people prefer this is that it does not cause weight gain, and it often helps people lose weight, so it's an attractive choice for patients. It works well for partial seizures. It does not work that well for tonic-clonic seizures, so it may be taken along with something else in that case. Third one is Neurontin or Gabapentin. Neurontin is used as an adjunct with other anticonvulsants to treat partial seizures. It's also approved for headache, diabetic neuropathy, and mood disorder. It's very expensive, and for a while the insurance companies would not approve it for anything but seizure disorder, but now that's loosened up. Like Topamax, it does not cause weight gain. You have to use it cautiously in kidney disease. Gabapentin in the order of drugs is fairly new, first being introduced in 1993. Gabapentin is not a narcotic or a controlled substance. However, for some reason, it has become a drug of abuse when combined with other medications such as opiates, muscle relaxants, and anti-anxiety medications, or if it's taken in too high a dose or mixed with other drugs. I guess what it does, it enhances the effect of the other drugs, and that's why people abuse it. It heightens the potency of opiates, muscle relaxants, and anti-anxiety medications. Crushing and snorting Neurontin in order to get high has been reported. and Neurontin is often used to cut heroin. So because of its high potential for abuse, it is counted and recommended to be considered a controlled substance. Another newer med is Kepra. It is used to treat tonic-clonic seizures and partial seizures. It is excreted through the kidneys, so it has to be used with caution in renal disease. Kepra is proven not to be effective with mood disorders. Next is Lamictal. It's also an adjunct therapy for tonic-clonic, so you would have another seizure med and partial seizures. It also is used for mood disorders. Stevens-Johnson syndrome can occur when you take it. And Stevens-Johnson syndrome can occur with many meds. You've always got to be aware of that. And Lamictal also helps with mood disorders. Triliptal, another seizure med, is used to treat partial seizures and for adjunct therapy with tonic-clonic. For off-label use, it's good for trigeminal neuralgia. That's when you have neuralgia in one of your facial nerves. And they also use that for mood disorders. So I don't know how they, with all these anticonvulsant medications, when they were invented, they must have discovered that they not only helped the seizure activity, but the people that they were treating were in much better moods while they were taking it, because almost all of them are used in treating mood disorders. The last one I want to talk about is phenobarbital. Phenobarbital is a barbiturate and is considered a controlled substance. It's categorized as an anticonvulsant and as a sedative hypnotic. Phenobarbital's been around a long time. It's an older medication that was used to treat seizure disorders before less potent, non-addicting anticonvulsants were discovered. Nonetheless, you still see it being used to control seizures, particularly seizures in status epilepticus. When treating status epilepticus, phenobarb is given IV. The dose is weight-based. The maximum loading dose is 20 milligrams per kilogram. Like Delanin, phenobarb is given for status epilepticus after the short-acting effects of Ativan or Valium wear off. Phenobarb is a narcotic and should be used with caution, as it can lead to dependence, tolerance, and abuse. So, remember for status epilepticus, IV Ativan or IV Valium initially, but because it is short-acting and will only last about an hour, IV barbiturates like phenobarb or Delanin are given for long-acting results. To end this lecture, I want to just go through some of the important nursing measures and patient teaching for anticonvulsants. First, I've said it already 100 times, but bear with me. Do not omit, increase, or decrease the prescribed dose of the medication without a doctor's order. Number 2, abruptly stopping an anticonvulsant can lead to status epilepticus. And in bold, I have written, abruptly discontinuing an anticonvulsant is the most common cause of status epilepticus. If a dose is forgotten, take it as soon as it is remembered, unless it is almost time for the next dose. Omitting doses may lead to an increase in seizure activity. Increasing the dose of an anticonvulsant could lead to toxicity and adverse effects. Anticonvulsant blood levels must be monitored at a regular interval even if the seizures are well controlled. So when you first start on the medication, it will be frequent blood work. Once you have established a therapeutic level, you will be monitored probably every 3 months unless you have a change in your status. Anti-convulsants cause drowsiness. Do not drive if drowsy, dizzy, or experiencing blurred vision. When an anticonvulsant is prescribed, it is titrated or gradually moved up to the therapeutic dose. When an anticonvulsant is being discontinued, it is tapered slowly unless there is a serious adverse reaction such as hypersensitivity, like Stevens-Johnson syndrome, in which case you unfortunately have to stop it immediately. The patient has to be seizure-free for at least 6 months and have a doctor's order to resume driving. Avoid alcohol. Alcohol ingestion increases the effects of anticonvulsants, which can exaggerate the CNS depression, leading to increased sedation. Carry an ID, a MedAlert bracelet with a type of seizure disorder and anticonvulsant med being taken. Do not take any non-prescription drugs unless approved by the healthcare provider. Remember, many meds interfere with anticonvulsants. Inform the dentist and the HPC about the use of anticonvulsants. Remember, Delanin especially causes blood dyscrasias, such as leukopenia and thrombocytopenia. Delanin can also cause gingivitis and hyperplasia of the gums. Schedule periodic periodontal and dental exams. Brush and floss your teeth after every meal with a soft toothbrush to reduce bleeding, and that again is with Delanin. Keep a record of all seizures, the date, the time, and the length. Note on the record any problems such as drowsiness, dizziness, lethargy. Always bring the seizure record to the doctor's appointment. Contact your local agencies such as the Epilepsy Foundation for information and assistance with questions and concerns, such as legal matters, insurance, driver's license, low-cost prescriptions, job training, etc. And finally, patients taking anticonvulsants should avoid drinking grapefruit juice, as it reduces the metabolism of these meds, raising plasma levels, which could lead to toxicity. So remember that about grapefruit juice. Again, I wish you all the happiness in the holidays, and I'm looking forward to seeing you next year. Hopefully it's right around the corner and we'll be able to meet again in person soon.